Hello, my name is Chris Thompson. This is Jessica Thompson. She is volunteering to participate as my assessment partner. Um, Ignore the fact that she's 32 weeks pregnant. That's not part of the exam. Make believe that she is a 60-year-old man with a BPH and trouble urinating and nocturnal, increased nocturnal urinary frequency. Her birthday is April 1st, 1963. And yeah, we're going to start off with head, eyes, throat, mouth, nose, ears assessment. Hello, my name is Chris Thompson. Jessica, can you tell me your birthday just to validate this paperwork I have here?
April 1, 1963.
Perfect. Okay. And you know where you are right now?
I'm right here.
Okay. All right, we're going to start off. Is it okay if I do a assessment of your scalp?
Yes.
Okay. All right. I'm going to start off by inspecting your scalp here. No obvious lesions, no signs of lice, no pustules, anything like that. Okay, gonna check your temporal arteries here. Pulsation on both sides. Okay. We're gonna check your eyes real quick. I'm gonna start off with seeing how your extraocular movement is. So look at my finger, follow it around the room, and then in the middle here. Next, we're going to check your visual field. So look at my finger here, and I want you to tell me how many fingers I'm holding up in your peripheral vision, okay?
2.
Okay.
1.
Okay. Look at my finger here.
2.
Okay.
3.
All right, look at my finger again.
2.
Okay, perfect. Okay, we're going to check for a red reflex here with your eyes. So I'm going to shine a light on your pupils. Look straight at my nose. Okay, red reflex intact. Look at my nose again. Okay, red reflex intact there. Next, I'm going to look at your nose real quick. I'm going to palpate your sinuses. Have you been having any pain in the front of your face or the sides here? Okay. No swelling, no tenderness here. Okay, next give me a smile. Okay, stick your tongue out, move it from side to side. Okay, tongue is midline, no tongue deviation. Open your mouth and say ah for me. I'm going to shine a little light in your mouth while you do that. So one more time, sorry. And uvula rises, soft palate rises. Next, we're going to we're going to check your ears real quick. We're going to start off with a whisper test. I'm going to whisper a word in your left ear, and you're going to tell me what you hear, okay?
Apple.
Okay. Over here.
Pear.
Okay, perfect. Next, we're going to check see if you have one side that's stronger than the other for conduction. So I'm going to hit this together and put it on your forehead, and you tell me if one side you hear it stronger than the other, okay? You hear either side is stronger than the other?
Mm-hmm.
Both equal?
Yes.
Okay. All right, next I'm going to do this. I'm going to hit it behind your ear. I'm going to hit this, have it vibrate again. I'm going to put it right here behind your ear. You're going to tell me when you stop hearing it, and then I'm going to hold it in front of your ear here, and you're going to tell me if you still hear it, okay? All right.
I hear it.
Okay. So air conduction is better than bone conduction, that's normal. We're gonna do it on this side here. Tell me when you stop hearing it.
I don't hear it anymore. I hear it.
Perfect. Next, I'm going to palpate your neck here. We're going to feel for some lymph nodes around your neck and your head. We're going to move in a kind of a circular clockwise, counterclockwise movement, just kind of lightly palpate. We're going to start off here and do the preauricular space. Then go behind your ear and do the postauricular space. We're going to do behind your head here. This is the occipital space. We're going to go right here. This is the subtonsillar area. And here's the submandibular. And sublingual right here. And we're going to go down here and find the sternocleidomastoid muscle, go in front of it and work our way down, light circular palpation. These are the anterior cervical lymph nodes, and we're going to go behind the sternocleidomastoid muscle right here, work our way down here, feel for any lymph nodes here, and we're going to work right here, and check for any swollen lymph nodes here. Next, I'm going to ask you to shrug your shoulders for me, okay? All right, so far intact, no swollen lymph nodes, nothing to be alarmed about. Cranial nerve 11 is intact. All cranial nerves that I could assess for seem to be intact. Is it okay to assess inside your ears real quick?
Yes.
Okay.
So the tympanic membrane is intact. There's a little bit of earwax in the ear canal. No signs of infection. Tympanic membrane, light reflex is intact.
I'm gonna check this side here. Tympanic membrane is intact. Light reflex is intact. Tympanic membrane is clear. A little bit of earwax in the canal again, but looks good. Okay, next we're going to do a assessment of your back. I'm going to listen to your lung sounds, do a little palpation, just to see if watch you breathe, check to see if there's any crepitus or anything like that. Do you mind turning your back towards me so I can do an assessment real quick? Okay, I'm going to move your hair out of the way here. Okay. I'll work my hands down your back. Check for any deformities here. Spine's in alignment. I'm not feeling any crepitus. Is that causing you any pain?
No.
Okay. Next, I'm going to palpate the lung fields. Okay, I'm going to go to the other side here. Take a listen to you real quick. All right. Deep breath in and out. 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 And in. And out. And in. And out. Okay. Can you whisper something? Whisper something one more time. Okay. Next, I'm going to listen to your lung sounds on the front as well as your heart sounds. So if you don't mind turning back around for me. Okay. So I'm going to check here again. Signs of crepitus. Okay, skin looks good, no lesions. Okay. I'm going to take a listen to you again, okay? Deep breath in and out. Deep breath in and out. Okay. Deep breath in and out. Deep breath in and out. Okay. I'm just going to listen right here. Do you mind lifting your arm up? Sorry. Deep breath in and out. Okay. And deep breath in here and out. Okay. Next, I'm going to listen to your heart sounds. And we're going to start here on the right side. We're going to listen to the aortic valve with the, okay, we're going to listen with the bell now. No clicks, S1, S2 heard. No signs of regurgitation, stenosis. You listen here, pulmonic valve. Okay. You listen with the bell here. Okay, no clicks, no regurgitation, doesn't sound like any stenosis. I'm going to listen to Erb's point here. Okay. And listen with the bell as well. Okay. No splitting, no regurgitation. I'm going to listen to your heart. I'm going to listen to the tricuspid valve. Take a listen from the side here. All right. There you go. Listen with the bell. Okay. No signs of regurgitation or stenosis. No clicks, no splitting. Just going to listen here to the mitral valve. And listen with the bell. Okay. All right, heart sounds really good. Next, I'm going to have you, I'm going to move this real quick. I'm going to set this up about 30 degrees. Do you mind laying your head here for me? I'm going to do an assessment of your stomach, your abdomen, and then look at your jugular veins, things like that. I'm going to move your hair here to the side. Oops, sorry. Okay. You can see here that there's no pulsations. Is it okay if I touch by your heart here?
Mm-hmm. Yes.
Okay. I can't feel any tremors. And I see no jugular vein distension. Yeah, lift your chin up for me just a little bit. No jugular vein distension. Okay. I'm also going to lightly, since she's pregnant, all the abdominal assessments have to be a little bit more gentle. light palpation here. Any pain that you've been experiencing in your abdomen? Or lightly percuss the abdomen here. I'm gonna listen to the abdomen for bowel sounds. There's tympany, very little tympany present. A little bit of dullness over the stomach, and the liver. Just gonna take a listen real quick. Bowel sounds are active. I'm going to pretend to deep palpate here. Don't want to cause any discomfort. No mass is found. I'm going to have you sit back up real quick. Sorry. I'm going to assess any pain here when sitting back up.
Nope.
Next, I'm going to do an assessment of your hands and arms. I'm going to start off by checking your fingers here. I'm going to look for any obvious deformities, just going to feel your joints here for any crepitus, any inflammation. So far, none on either side. I'm going to look at your fingernails while I'm here. There's no clubbing, nothing like that. Squeeze my fingers for me as hard as you can. Pull me to you. Good. Push me away. Good. Hold your hands out like this. Close your eyes. I'm going to put something in one of your palms. You tell me what it is. Squeeze. Okay? Good. Okay. Now keep your hands out, and I'm going to trace something in your palm, and you're going to tell me what I've traced.
2 lions.
Okay. And
Heart.
okay, perfect. You can open your eyes. I'm going to check your pulses here. Pulses are strong. And hold your arms out like this. And sit forward for me. I'm going to push down just a little bit. Good, nice and strong. Now push down towards my hands. Good, nice and strong. Okay, now I want you to move your hands like this. Okay. Any issues with any of the movement there? Any pain?
No.
Okay, spread your fingers out like that. I'm going to push against them, try to keep them out. Good. Okay, now close your hands. Now spread your fingers. I'm going to put a little resistance. Good. Now I'm going to check your thumbs. Take your hands, go like this. And then palms up. Flip them over and back. Over. Okay. And hold your arms out like you're holding a pizza box. Close your eyes while you do it. Perfect. Okay. Put your arms down. Also going to double check your sensation here on your arms. Can you feel the light touch here?
Yes.
Okay. I'm going to check your capillary refill here. I'm just going to squeeze your finger. Perfect. Under 2 seconds. And then this one. Great. Under 2 seconds. Also with your arms, can you straighten them out completely for me? Just go here, there, no obvious deformity. Go pull them halfway back. Okay. Any pain in that motion here? Okay. And then you can pull them all the way closed. Push you there. Okay. Now, can you put your arms out like this again, and then go around in a circle? Not that much, just a little bit here. Any pain with that motion?
No.
Okay. I'm gonna do one more test on your wrists here. I'm gonna test for your sense of vibration in your arms. You're gonna hold your hand out like this. And you're gonna let me know, can you feel this vibration here?
Yes.
Okay, we're gonna try the other arm here.
Yes.
Yes, okay. Alright, next thing we're gonna do is gonna do an assessment of your legs and feet. I'm gonna help you take your shoes and socks off here. I can look at your feet. Alright. Look at your toes here. They're pink, there's no clubbing of the nail. Can you flex your toes out for me? Good. And then push down. Perfect. Any pain with that movement? Okay. Check your cap refill. It's under 2 seconds. Take your pedal pulses here. Okay. So +2. +2. And do posterior tibial. Also +2. So +2. Okay. Next, I'm going to have you take your toes and pull your toes up to the sky. And don't let me push them down. Good. And then push down a gas pedal in my hands. Good. It's 5s for sure. Alright, so next we're going to check your vibration sense. The external malleus right here. Can you feel it vibrating?
Yes.
Okay. We're going to check this other side here. Yes? Okay. Alright. Next, I want you to do is push out against my hand here. Good. And then pull down against it. Good. And then push out against it here. Good. And pull down against it. Good. And I'm going to check your joints here. Any pain here?
No.
There's no swelling, no nodules. Okay. And next portion of the exam, I'm going to have you stand up. And the first thing I'll have you do is close your eyes while you're standing still. I'll stand next to you here. Okay. No swaying, no change in balance. Okay. Next, I'm going to stand next to you on your right side here. You can open your eyes. Can you lift your hip out for me like that? Okay. And then bend your knee up. Good. And same side here. And then out. Okay. And then I'm going to have you bring your leg out to the right. I'll step away here. Okay. And then same on that side. Okay. Check your hip joint here. Any pain, any swelling that you've noticed? Okay. Okay. I don't see any edema. Intact movement. Strength's 5 out of 5. I'm gonna have you take a walk over here real quick. And turn around and walk back. Okay. We're not gonna do the jumping test. She's 32 weeks gestation, so probably not a good idea. Her balance isn't the greatest. Next, I'm going to do, no jumping. And I'm going to check for, can you feel me touching your leg here, all the way down? Any numbness and tingling that you've noticed? Okay. All right. And that's it.